Good morning and welcome to the third meeting of the Nevada Silver-Haired Legislative Forum. First, we will call the roll. For those members attending virtually, please turn on your cameras and respond when you hear your name. Madam Secretary, please call the roll.
Ms. Aden, Ms. Batts,
Present.
Ms. Bongiorno,
Present.
Ms. Daniels,
Present.
Ms. Fesenmeyer,
Present.
Dr. Jordan, Ms. Laura Levitt,
Here.
Ms. Peggy Levitt, Mr. Linden,
Present.
Dr. Marchant,
Present.
Ms. Martinez, Mr. Raja,
Present.
Mr. Silberkraus,
Present.
Mr. Troth.
Can you hear me?
Yes, thank you. Mr. Troth,
Present.
Mr. Slaughter,
Present.
Ms. Tyler, Ms. Woods,
Present.
President Alvarez.
Present. Madam Secretary, please indicate Elizabeth Martinez, Marilyn Jordan, Lucio Aden, and Rosie Tyler as excused. Please record any other absent members as present when they arrive. Before I begin, I would like to make some housekeeping announcements. First, I would like to remind everyone to please silence all your electronic devices, especially cell phones and laptops, during the meeting. For members joining online, please mute your microphone when you are not speaking, but leave your camera on. Everyone should sign the sign-in sheet at each location, even if you do not intend to testify. When testifying, please remember to turn on your microphone and clearly state your name and the entity you represent at the beginning of your testimony. Speak directly into the microphone to ensure those listening in other locations and watching online can hear your testimony. Please remember to turn the microphone off when you finish speaking. Each witness should leave a business card by the sign-in sheets or with forum staff. Meeting materials for this meeting can be accessed on the forum's webpage. Individual public copies are also available in each meeting location. Anyone who would like to receive electronic notification of access to the forum's agendas, minutes, and final report can also do so by going to the Nevada Legislature's website and following the links. With that, we'll get started. First order of business, the forum would like to formally thank Ms. Cher Daniels. Senator Ira Hansen has nominated her from Senate District 14. We'd like to welcome you and look forward to working with you. Thank you. Agenda item 2 is public comment. Time for public comment is provided at the beginning and again before the conclusion of the meeting. Public comment will be limited to 2 minutes per speaker. We will time each speaker, providing public comment to ensure everyone has a fair opportunity to speak. Speakers are encouraged to keep their comments as brief as possible. Speakers are also urged to avoid repeating comments or points made by previous speakers. Any person may also submit written comments to the forum secretary during or after today's meeting. In addition to testifying in person, members of the public may provide public comment over the phone or in writing as indicated on the agenda. We will start with those in the physical locations and move on to anyone who has called in. Is there anyone in Las Vegas who would like to provide public comment? Seeing no one, is there anyone in Carson City who would like to provide public comment at this time? Seeing no one, our broadcast and production services, in short, BPS staff will interact with those phoning in for public comment. BPS, please add the first caller with public comment to the meeting.
Good morning, Madam President. The public lines are open and working. However, there are no callers to provide public comment at this time.
Seeing there are no callers, we will move on to our first order of business, the approval of our April meeting minutes. Board members, do you have any questions regarding the minutes? I will entertain a motion to approve the minutes of the forum meeting on April 9, 2024.
I move approval.
Mr. Marchand
second
has made a motion to approve the minutes. Is there a second?
I second the motion.
I have a second from Joanne Borgiano. Is there any discussion? All in favor say aye. Aye.
Aye.
Any opposed? Thank you. The motion carries. Agenda item 4 is an overview of efforts to reduce food insecurity for senior citizens in Nevada. We will hear from Sarah Rogers, Nutrition Unit Deputy Chief with Child, Family, and Community Wellness of the Division of Public and Behavioral Health, who will offer a presentation on food insecurity and senior citizens. After her presentation, we will hear from Allison Genko, Chair of the Nevada Governor's Council on Food Insecurity. We will take questions from foreign members at the end of the presentations. Ms. Rogers, feel free to begin when you are ready.
Thank you very much, President Alvarez. My name is Sarah Rogers, and I am the Nutrition Unit Deputy Chief with the Bureau of Child, Family, and Community Wellness within the Division of Public and Behavioral Health. I'm going to go over food insecurity and senior citizens today. A little bit about the Division of Public and Behavioral Health, an overview of what I will be discussing today. So first, when we discuss senior hunger, it's important to go over the implications to hunger that are more specific to seniors and older adults. The baby boomer generation is the fastest growing population in the United States. Individuals a part of this generation are now between 60 to 78 years old. Data projections suggest that Nevada will witness a 36% increase in the older adult population over the next 10 years, anticipating that by next year we'll have 100,000 older Nevadans that will need nutrition and emergency food services. While food insecurity impacts all ages, it is especially prevalent among older adults as they face unique challenges compared to other age groups. They're more likely to have poor health conditions, lack social support and transportation beyond low fixed incomes, have disabilities and functional limitations that impact their ability to access or prepare foods. Having a disability is strongly associated with food insecurity. Seniors that have a disability had a food insecurity rate twice as high as seniors without a disability. And for older adults with disabilities, they have an even more greater likelihood of being food insecure, as they're 3 times more likely than their counterparts to be food insecure. Food insecure is a strong predictor of poor health and disease, such as heart disease, stroke, lung disease, and diabetes, and it impacts the ability of the individual to age in place. Food insecure seniors and older adults consume lower quantities of key nutrients such as iron and protein, and they're more likely to have chronic health conditions such as depression and limitations in daily physical activity. 4.6% of Nevadans age 60 and over were food insecure in 2021. The national average in 2021 was 7.1%. The USDA is projecting an increase in this population to 9.1% in 2022, and that's for seniors 65 and older. 11.3 of Nevadans who are in the older adult range, which is 50 to 59 years, were food insecure. And this age group does exceed the national average, which was 9.4%. Across the age spectrum, food insecurity is experienced at disproportionate rates by communities of color. Black seniors are 3.8 times more likely to experience food insecurity, and Latino seniors are 3 times more likely to experience food insecurity. Race information for Asian, Pacific Islander, and Natives are unfortunately not available. However, it is worth noting that they do show food insecurity rates that are also disproportionately high, especially those in Native American and Pacific Islander subgroups. So the Office of Food Security is located within the Division of Public and Behavioral Health, and specifically within the Nutrition Unit under the Bureau of Child, Family, and Community Wellness. And the mission of this office is to effectively improve the quality of life and health for Nevadans by increasing food security throughout the state. The Office of Food Security manages a portions of the funds for Healthy Nevada to specifically address hunger. FHN supports initiatives and programming aimed at reducing hunger, promoting public health, and improving health services for children, senior citizens, and persons with disabilities. The office also leads the implementation and support of the 2023 Food Security Strategic Plan, and they provide administrative support to the Governor's Council on Food Security. So in order to better understand how the food system worked in addressing the needs of food insecure older Nevadans and how funding for these systems were distributed, in 2018, the Office of Food Security collaborated with the Council on Food Security and other partners to develop strategies and preliminary recommendations, which was published in the Nutrition Programs for Older Nevadans and Preliminary Recommendations report. Key informants were service recipients, senior service recipients, and to ensure the consumer voice was reflected and the priorities, they utilized the 2016 Needs, Priorities, and Recommendations, which was a meta-analysis, a summary report for services and supports for the aging population in Nevada and those with disabilities. This analysis included focus groups, town hall meetings, key informant interviews, and surveys, all with older Nevadans and seniors and persons with disability in order to obtain some recommendations. Some of those recommendations included expanding access to older adults for food and nutrition services programs, improving support systems to promote partnerships with nonprofits and religious organizations, and help improve overall quality of life by enriching the lives of isolated seniors and those living in group homes. Also in 2020, amidst the height of the COVID-19 pandemic, the Office of Food Security published a series of reports on how Nevada is combating the statewide hunger crisis. Due to the increase on the burden of seniors, the Office of Food Security did put out a senior-focused report to highlight specific hardships related to food insecurity faced by Nevada's senior population during this time. The COVID-19, while a threat to all Nevadans, was especially harder on the older adult population. They were at higher risk of experiencing severe symptoms. There were lots of closures and mandates and harder times navigating the system. However, it was noted in the report that due to the increased services that were needed, some services were easier to access, and there was more utilization among the older adult population of some of these services when they were able to access them in a different manner than they had been before. So Office of Food Security also administers a portion of the Funds for Healthy Nevada. They receive $4 million each biennium. During the 2024-2025 Notice of Funding Opportunity, $2.9 million was requested from partners. And in actuality, 11 partners were funded the $4 million, which is half of about what they indicated was needed. The goals and objectives of the 11 FHN recipients are specific to enhance food security in the state. Each partner provides individuals and families with food to meet their needs. It is required that 50% of these funds are to be spent on food. FHN partners also assist recipients in finding long-term solutions to support their food security, such as education, housing, and jobs. Distribution of these foods are focused on fresh foods, non-standard perishable foods, and more protein-rich foods, increasing the protein options and the fresh options for the recipients. The most common ways customers are served through FHN are through pantry services. They're also served through large distribution centers, provided cafeteria style food periodically to specific communities like senior centers and low-income housing communities. In state fiscal year 2022 and state fiscal year 2023, the senior population was the largest population served by FHN, behind the 18 to 59 age group. The Office of Food Security updated the state's food security strategic plan. So now we have the 2023 Food Security Strategic Plan. And during the planning process for this, they garnered important feedback from the senior community and senior meal providers. There were focus groups dedicated specifically to the senior population. Some of the notable findings from this plan did include that the top indicated barrier to access food was transportation, followed by lack of knowledge on where to access foods. Next was need and seeking services. Community members indicated that they needed to seek food security services because items like utility bills, rent and mortgage, phone bills, and transportation costs were too high. And they also identified a gap in the food security ecosystem and proper service to isolated seniors, specifically those who are residing in rural or frontier areas. So within the food security strategic plan, there are 5 pillars. One of those pillars we call the feed pillar, and this specifically highlights the needs to address barriers around access by bringing food to people. Almost 89% of Nevada's population and infrastructure are concentrated in its urban population, centers in Las Vegas and the Reno-Sparks area. So communities, a lot of Nevada communities are vulnerable to logistical challenges when it comes to receiving food. As we know, a lot of community members and partners did indicate that transportation was the top barrier when accessing foods at 30%. So one of the goals in this feed pillar is for Nevada to have an efficient logistics, distribution, transportation, and storage system to address food insecurity. And our measure of success for this goal was indicated that it could be an increase in the number of Nevadans receiving food through mobile delivery options or other innovative ways where we can bring food to the people instead of the people to the food. The next pillar that specifically addresses seniors within this plan is our Grow pillar. And the Grow pillar focuses on Nevada being able to feed itself and consume more local foods. And they do this by supporting the expansion of state or local programs that promote the consumption of locally produced agriculture. Within this goal, the strategy is to work with partners to address barriers and in access and serving local foods, particularly in systems that serve senior citizens. Also promote participation and garden education and programs in places like schools, institutions, senior centers, and child care centers. So based on reports published by the Office of Food Security and some findings within the strategic plan, a few recommendations to address senior hunger can include maximizing food access by encouraging utilization of all food programs for which older Nevadans and their dependents are eligible for. Collaborate more with transportation services to improve access to foods in those hard to reach areas. Support innovative approaches in home delivered meals and groceries. Also expanding diversity in foods available through food banks, commodity foods. We need to address nutrients that seniors specifically need, so more protein-rich options, iron-rich options that they're not getting a lot of already. And then also supporting all efforts to secure Medicaid and Medicare funding for reimbursement of nutrition-related services and ensure meal reimbursement rates are adequate. And I'm open to any questions. My contact information.
Thank you, Ms. Rogers, for this presentation. We will take questions from the forum. Does anyone have a question? If you are online, please indicate with the raised hand, or anyone here, please raise your hand. Mr. Slaughter, you have a question?
Yes, I do. When you talk about food insecurity, do you also address the fact that, you know, and I heard you actually almost answer the question as far as, say a senior citizen has a special need, diabetic, or even if it's a religious kind of situation where, you know, this person doesn't eat shellfish, this person doesn't eat pork. What type of food can you provide for those individuals?
Yeah, thank you for the question, Mr. Slaughter. So as far as those types of foods, that there's a lot of prescription pantry options that could be available to those types of individuals. And I know there are some around. We don't specifically fund any that I'm aware of off the top of my head, but I know that we have community partners that do the prescription pantry style, and that's part of also, you know, needing to expand the food options that are available in food pantries, so people with dietary restrictions are still able to find what they need, whether it's considered a prescription pantry or not.
Case in point, years ago, I'm a boxing trainer by trade, and I had a boxer from France, but he also was Muslim, and he needed a special kind of diet. So I had to look up what kind of diet this young man needed to perform at a high level, and I had to go to certain markets in Las Vegas area that served what they call halal food for this boxer. So there are also religious reasons why a person might not be able to access the foods that are given to you by your organization.
Yeah, thank you, Mr. Slaughter, Sarah Rogers, for the record. And I agree. I think expanding the variety into it, you know, improve equity as well with food delivery options too, or food access options is something that's very important. We need to focus on. Absolutely.
Thank you. Mr. Marchand, have a question?
It says ensure meal reimbursement rates are adequate. How do you measure that, and when will you know when you have achieved that outcome?
So I will say that that is not something that's within our division specifically that we do, but I know that across other divisions that do the meal reimbursements, they have a method for calculating those meals. So I included that in there just to make sure that those are always brought to mind, you know, as inflation is coming around, ensuring that meal reimbursements are always up to standard has been something that we need to do to ensure that meal deliveries are adequate.
So you're telling me that someone somewhere is trying to work toward that goal?
So I will say that it's a goal that we need to always keep in mind. As of right now, I believe they're adequate. But that was just included in there as based off of our research, things that were recommended that we keep doing.
Okay, thank you.
Thank you. Ms. Bongiorno, you have a question?
Yes. How does one apply for your services? And what is the criteria that's necessary for that?
Thank you, Ms. Bongiorno. So for our specific services within the Division of Public and Behavioral Health, we utilize the FHN fundings to fund food pantries. So you would go into a food pantry, one of our food pantries. We don't have specific services within our division that you apply for.
Is there a list of food pantries,
Yes, I can supply that for you.
please? Thank you.
Thank you, Joanne. Mr. Toth?
Thank you for your presentation. Roger Troth from Senate District 18. On slide 8, you list 11 partners that are awarded state financial in the years. Can you give us an example of who some of those partners are?
Yeah, absolutely. Sarah Rogers for the record. So some of the partners off the top of my head, they are 3 Square Food Bank, Food Bank of Northern Nevada, Dignity Health, Catholic Charities of Southern Nevada, UNR, and those are the ones that are coming to the top of my head.
Are most of them nonprofits?
Yeah, majority, yes.
Okay.
And a lot of them also fund other food pantries under them as well.
And do they request, like on an annual basis, to be part of this program so they can get funds from the state?
Yeah,
How
so
often
we
do
run
they have
off
to
of
do
a
that, do you know?
biennium. Yeah, so it's every other year we put out a notice of funding opportunity, and then they have to apply.
Okay, and then one other question, and then I'll be quiet. On slide 11, you talk about working with partners to address some of the barriers. What are some of the things that you guys have heard that are barriers to some of these actions and trying to provide these services?
Yeah, so the number one, sorry, Sarah Rogers for the record, the number one barrier that we heard was transportation. It's also just knowledge about where to access these programs. A couple other barriers that I remember off the top of my head was confusion to and applying, stigma, embarrassment, also the perception that they may not qualify for additional programs, so they just don't apply.
Awesome, thank you. That's good information.
Ms. Peggy Levitt?
My question has to do with Meals on Wheels. When you're talking about transportation being a barrier, and I'm a driver for Meals on Wheels in my community, Boulder City, which would be considered a rural area. So I wondered how many, because you didn't address Meals on Wheels at all. I don't know if they receive some of your funding. I know they get some federal funding, and then we fundraise as well for Meals on Wheels in Boulder City. Do you have active Meals on Wheels programs in other rural communities?
Sarah Rogers for the record, thank you for your question. So within our division, the Division of Public and Behavioral Health, we do not do Meals on Wheels. That is administered through a different division.
I'm sorry, you don't have them in other rural communities?
I just can't speak to Meals on Wheels because that's not my division. I don't want to speak for a different division, and I believe they are here today. And we'll be talking later. Yes, they're next.
Oh, so they will address that?
Yes, they're saying yes.
Okay, thank you.
Peggy, can you turn off your mic, please? Thank you. Are there any other questions for Ms. Rogers? I have a question for you, Ms. Rogers. You named some of the partners that you have for 24, 25. And you had a $4 million budget biennium, but people had requested, or entities had requested, 7.9 million. Do these, the money, does it go out by grant? How do you determine who gets how much?
Thank you for the question, President Alvarez. Sarah Rogers for the record. So when we release the notice of funding opportunity, we allow all the applications to come in, and then we conduct an evaluation committee that's comprised of individuals from different programs and divisions within the state to review the applications, make sure that they've met all the requirements of the application, and then the committee, based off of who they are proposing they're serving, what area of the state that they're serving, the evaluation committee then brings recommendations to our grants management advisory committee, who makes the final recommendations on funding. So I believe this last round of notice of funding opportunities, we did fund everyone who applied. We just reduced the amounts to fit within the budget, and also based off of their scope and capacity, we adjusted some things as well. They indicated, with the cost of food inflation and the increase it takes to administer the programs as the reason for requesting the additional money. But we do need, when we do go through the evaluation process, we need to make sure that each entity is serving every area of within all the ones together, every area of the state is covered, and every population is covered.
You're estimating an increase of 36%, approximately 100,000 seniors by 2025 that are going to be needing help. Do you anticipate, or are you asking the legislature to increase your budget?
Sarah Rogers, for the record, I'm not asking for a budget increase. I just want to make everyone aware of the identified needs and increased needs based off of inflation and estimated increase in the older Nevada population.
Roger Troth?
Okay, so a follow-up on that, and that's something that we can look at is, so your budget comes, what section of the state budget does your money come from? And the legislature has to authorize that budget. Are you part of somebody else's, HHS's process in amount of budgets? And this is something we can use as a BDR factor. Thanks.
Thank you. Sarah Rogers for the record. So we, the Office of Food Security is completely supported through Funds for Healthy Nevada, which are the tobacco settlement dollars. We receive 60% of the tobacco settlement dollars, and that is run through our director's office at the Department of Health and Human Services, and then provided to us to administer the hunger funds, or the FHN funds, we call them, the hunger portion of FHN.
I have a follow-up to that. Fran Alvarez, do you anticipate that the tobacco settlement dollars are going to have an increase so that your budget can increase? The difference between 4 million and almost 8, I mean, that's double. How do you anticipate, having more money to help this increase in seniors?
Sarah Rogers, for the records, I don't anticipate an increase in the tobacco settlement dollars. The tobacco settlement dollars are discretionary and they don't have to be provided in the way that they are each year. So every year it can be administered differently just based off of the discretion of the director of the legislature. What we do at the office is we continue to seek grants. We try to expand services as we can by seeking grants. We utilize other grants in the section of our bureau as well to help support some initiatives of the office. But as of right now, no, we don't.
Is it in NRS that you get the tobacco dollars, or is it, like somewhere else that says these dollars are for your budget?
It's not codified anywhere that I'm aware of. That's just the way they've been distributed.
Are there any other questions for Ms. Rogers? Seeing no more questions, we will move on to the next presentation. Ms. Jenko, feel free to begin.
If someone is up north, I don't see my slides on this computer. May need some help.
1 second, Allison, I got it.
Yeah. Just may need someone to help drive the boat. Good morning, President Alvarez and members of the forum. For the record, my name is Allison Jenko. I am the Director of Nevada Government Relations for Dignity Health St. Rose Dominican, and I also have the pleasure of serving as the Chair of the Governor's Council on Food Security. I'm here today to provide a quick history of the Council, an overview of the membership, and the work of the Council that has been done over the last couple of years, and what we're looking to accomplish in the future. Next slide. So just some quick history. The Council on Food Security was established through an executive order by Governor Sandoval in 2014 to implement the goals of the food security in Nevada plan and effectively improve the quality of life and health of Nevadans by increasing food security throughout the state. And the council was then codified in law through NRS 232.4968 during the 80th legislative session. Next slide. So our membership, the Council on Food Security membership consists of a wide range of stakeholders, including individuals from the Nevada Department of Education, Catholic Charities, U.S. Department of Agriculture, the Nevada Department of Agriculture, and the Governor's Office of Economic Development, and so on. The council does meet quarterly along with special sessions, which helps partners remain aware of various funding streams and assist with improving the quality of service to meals and meals to Nevadans through education, recommendations, and feedback. Our next quarterly meeting will be in July, and fortunately it'll be in person. Most of our meetings have been virtual, so looking forward to meeting with the council and having a robust conversation. Next slide, please. So as Ms. Rogers mentioned, the council is currently tasked with overseeing the implementation of the 2023 Food Security Strategic Plan, which was recently published by the Office of Food Security. We're also working to oversee the implementation of the goals in the Food Security Action Plan that's in the State Health Improvement Plan, which was also recently published by the Division of Public and Behavioral Health. The Food Security Strategic Plan demonstrates a continued commitment to lead conversations with a broad set of food security ecosystem stakeholders, and creates ideas to build the capacity of agencies tasked with this work. So right now, we've been pretty successful in meeting goals that are in the Food Security Action Plan. At our last meeting, we were able to cross off quite a few of those goals. We're working on developing an annual conference, a food security conference. The first one will be in 2025, where we'll bring food security partners together to talk through longstanding issues and create some initiatives to continue to move the needle on food security. And then our next one will be held in 2027, and one will be in the north and one will be in the south. And the Office of Food Security is currently working on a survey to send out to partners to establish where we'd like to, what issues we'd like to focus on, what's most important to them, and get a sense of who would attend those conferences. Next slide, please. So I won't go too in-depth on the food security pillars as Ms. Rogers went through those earlier, but just want to give you all a sense of, again, the pillars that are in the Food Security Strategic Plan, what the council follows and guides us in our conversations when we meet quarterly. So again, it's lead, feed, grow, reach, and build, and those help inform some of those goals and objectives that are in the strategic plan. Next slide, please. And I included an example of a goal, an objective related to lead. So one of those is enhanced cooperation, communication, and representation to support policy development and resource utilization. And the objective under this pillar is to improve collaboration, communication, coordination, and information sharing among food ecosystem partners, which our strategy on this one, as I mentioned, is to organize and host an annual food security summit or conference. So as I said before, we're currently in the midst of developing plans on that conference. Next slide, please. So our future focus is in 2024, the council will continue to focus on the execution of the Food Security Strategic Plan and the State Health Improvement Plan Food Security Action Plan. We will be focusing on distribution, support, and general food access, and targeted collaboration with our state and local partners. And I highlighted the Home Feeds Nevada program and transportation. The Home Feeds Nevada program was a program that was created through an allocation of American Rescue Plan Act dollars to the Department of Agriculture to help create sustainable a sustainable focus on getting fresh foods out to the community. That money goes to local farmers, and that way that they can help get that food out, and we can get it to those that are in need. And then I also highlighted transportation, as this was a huge concern and issue that we need to address regarding food insecurity. And we actually just went to presented to the Interim Health and Human Services Committee last month or 2 months ago. My time is getting all fuzzy, but we asked for several additional seats to the council, one of those being a transportation representative to help once again move the needle on increasing access to food in underserved areas, especially in our rural communities. We also asked for a tribal representative, and then we asked for someone with lived experience to help inform the conversations and the implementation of the food security strategic plan. Next slide, please. Those are my acronyms. And then I think my contact information is on the next slide. So I am available for any questions.
Thank you very much for your presentation. Ms. Peggy Levitt, you have a question?
Thank you. I'm through, going through all these plans, I'm still having conceptually a hard time figuring out how food gets to people. So, again, I live in Boulder City. I think that's considered a rural area. So I also happen to sit on a board. It's called the Southern Nevada Regional Transit Commission, which is under the auspices of the RTC. So what we do through Silver Riders provide transportation for seniors in Boulder City, and they can take the bus to go to the local grocery stores. We also provide, we have a great senior center, so they can get meals there. And so Silver Rider will take them to the senior center. And we also have Meals on Wheels. So I guess my question, the Silver Rider will also take them into Las Vegas. So are other communities, do you know if they have those kind of services?
Thank you for the question, Ms. Levitt. Allison Jenko for the record. I can't speak to what other communities have specifically. I do know that here in Southern Nevada, Catholic Charities does a lot of the Meals on Wheels.
Right, I know they do.
Right, and it's very similar up in Northern Nevada. They again do home
But they
delivered.
don't service rural areas where that particularly is an issue
Sure.
from that first presentation.
So it's my understanding, Allison Jenko for the record, that the rural areas do get a lot of their meals from the food banks. So Northern Nevada Food Bank does service rural areas. They do have transportation that goes out to the rural areas. And I recently learned that the communities and schools serves as a hub for home delivered meals for individuals, but I think that's specific to children. I'm not certain of whether or not they deliver to seniors, but I think that is again a focus that the council is looking to have a better understanding of and help advocate for additional resources for those home delivered meals or Meals on Wheels for seniors, especially in those rural communities.
And this transit commission that I sit on also services Laughlin and Mesquite. So it isn't just Boulder City, but I think that they're primarily funded through the county, and also they get grants and that kind of thing too. But it might be something that you can look at and duplicate because it's a great service.
Allison Jenko for the record, I completely agree. We we are limited in our, we don't have any bill draft requests as a council, so we have to advocate through other avenues, but I certainly agree that we need to be advocating for additional funding for those resources and seeing where we can help increase the need. So thank you, I appreciate that.
Thank you.
Thank you. Are there any other questions? Seeing none, thank you very much, Ms. Rogers. And I just want to say, this is Fran Alvarez for the record. I applaud the commission or council for the people that you are adding. I think the council was lacking in those areas, and I think it will help immensely. I hope also, the only person I see is Mr. Duncan of the Aging and Disability Services. Perhaps you could find someone to represent seniors, just older people. Thank you very much for your presentation. Moving on to our next agenda item, an overview of access to health and social services for senior citizens in Nevada. We will hear a presentation from LaDawn Knighton, Social Services Chief with Community Services from the Aging and Disability Services Division, and Kristen Cullum, Social Services Chief with the Division of Healthcare Financing and Policy on access to health and social services specifically related to food programs for senior citizens of Nevada. We will take questions at the end. Ms. Knighton and Ms. Cullum, feel free to begin your presentation.
Thank you, Madam President. Kirsten Cullum for the record, and thanks so much for having us back, and appreciate you letting Ms. Knighton and I kind of tag back and forth during our presentation. So I'm going to go ahead and start for ours. And so what we're going to review today, hopefully we'll be able to answer some questions that came up under Ms. Rogers' presentation about access to services and transportation. So we're going to go through the home delivered meals that's funded through Nevada Medicaid, where I am with, and then Ms. Knighton will go in and speak a little bit about aging and disability services, their funded nutrition services, and then we'll just transition over to transportation that's available through Nevada Medicaid, and then ADSD, Aging and Disability, will also share about their transportation services. So Ms. Rogers and Ms. Jenko really teed us up for this. So we'll go ahead and start with the home delivered meals through Nevada Medicaid. So just as a background, Nevada Medicaid serves 1 in 3 Nevadans. So for Medicaid as well as the Children's Health Insurance Program, we have about a little over 900,000 members that are eligible and on Medicaid. And then in terms of individuals that are what we call dually eligible, so individuals that are oftentimes seniors that are on Medicare, which is the federal program, as well as Medicaid, we have a little under 100,000. So what I'm going to speak to in my presentation is services that are available for individuals that are on Medicaid specifically, and then Ms. Knighton can talk about kind of the more general population. So for home delivered meals through Medicaid, the service that we offer does include the planning, purchase, preparation, and delivery of those meals, as well as the transportation cost to transport those meals to individuals' home by the home delivered meals provider. These services do require prior authorization, so Essentially, the services are authorized for an individual who would be unable to prepare or obtain nutritional meals without assistance. So they would need that assistance to have those meals, or they're also unable to manage their special diet that is recommended by the physician. So that kind of gives you a picture of who would be eligible for these services. So it's not necessarily every senior, but individuals that really have that need to have that assistance to ensure a healthy life in their home. Meals are limited to 2 per day, so it could either be breakfast or lunch or dinner. That's the 2 combination options that someone could choose from. And historically, Nevada Medicaid only offered home delivered meals to individuals who are on our physically disabled waiver. I'll speak in a minute to how we did expand those services during COVID. So just in general, there are 5 home delivered meal providers that we have with Nevada Medicaid, and most meals are delivered frozen, although in northern Nevada and the Reno-Sparks area, we do have one provider. It's Washoe County Senior Services, and they do offer the option for hot meals if someone does prefer that. And so during the pandemic, one of the identified needs, as everyone was determining how best we could serve our recipients during the during the COVID pandemic. And so Nevada Medicaid did utilize some temporary funding that was available through the American Rescue Plan Act. That you might be familiar with that COVID funding opportunity. And so specific to home and community-based services, there was an opportunity for Nevada Medicaid to expand the home delivered meals. So individuals on the physically disabled waiver did still receive their services, but we did expand it specific to individuals on our frail elderly waiver. And so we did add that effective July 1st of 2022. And so when we went back and looked at utilization, we had about 1,400 individuals on our waiver, both in rural and urban Nevada, that did utilize that expanded service. I will say too, just in case you're not familiar with the term waiver, our waiver is limited to individuals that would normally be in a nursing facility or meet a nursing facility level of care, but with waiver services, they are able to have those wrap services in the community. So I apologize, I probably should have explained that in case you weren't familiar. So we did expand those services during the pandemic. And then the division also utilized the pandemic funding to conduct a rate study. So I know Ms. Rogers had a question earlier about that she spoke to about the rate methodology. And so Nevada Medicaid does have a rate methodology that we would have for our home delivered meals. So currently the rate is $5 a meal. And so this past year we did have a contractor that helped us really dive into those rates and that methodology to determine if it is sufficient. And so there was a recommendation to increase the rate that Nevada Medicaid reimburses for home delivered meals to, I think it's between $7 and $10. I'd have to double check. So there is that recommendation. I'm sure, as you all are quite familiar, that any increase to a Medicaid rate would require a budget initiative. So not something that Nevada Medicaid can take that recommendation and implement tomorrow, but certainly something that we have on our radar as a priority, and something that we would always, appreciate support from the forum if you so desire to write letters to legislators to also, encourage that rate increase to be added to our budget. So that is my overview for home delivered meals through Nevada Medicaid, and so I will turn it over to Ms. Knighton to speak to what Aging and Disability has, and then as I understand it, we're taking questions at the end.
Good morning. So as stated, my name is LaDon Knighton. I am a Social Services Chief with Aging and Disability Services, or ADSD. So ADSD services are provided through community partners. The services that are funded through ADSD are primarily focused to serve individuals who are not on Medicaid and not on the waiver, but who are older adults, persons with disabilities, and family caregivers who, with the overall vision and goal to support independent, healthy living through services. Excuse me, sorry. So through multiple funding sources, including federal funding, state funding, a fund for Healthy Nevada, ADSD provides an array of services through community partners. In a previous presentation, we provided descriptions of those services, which include nutrition services, caregiver support, assistive technology for independent living, Medicare counseling, and senior employment services. Today, the focus is on nutrition and transportation services. So services funded through ADSD for nutrition are designed to address hunger, food insecurity, malnutrition, social isolation, health and well-being, and also to provide education to improve food choices and overall health and well-being. ADSD provides services with an approach person-centered and wraparound services to not only meet the needs of older adults in the area of nutrition, but in all areas of living. Nutrition services are free to individuals and they are offered statewide. There was question about availability in various areas. ADSD does support community partners in rural areas and tribal areas as well. Individuals who are eligible to receive nutrition services under ADSD funding include older adults age 60 and over, their spouses of any age, persons with disabilities who live with eligible older adults, or who reside in housing facilities with a majority of older adults receiving meals, and people who provide volunteer services during meal hours, such as in our senior centers. ADSD requests of our partners to prioritize populations who have the least access and the least personal resources to obtain needed services, including those with low income and minoritized populations. The services funded under ADSD nutrition include home-delivered meals, as previously described, and also congregate meals in a congregate setting to increase socialization, such as through our senior centers. As you can see on the slide before you, the funding over the past few years for these services has fluctuated. Also, which has fluctuated is the demand for services. There has been an increase in demand for these services over the past years. Although we are not at the end of state fiscal year 24, we do anticipate an increase in the number of individuals seeking home-delivered meals or congregate meal services. You will also notice that there is a wait list, a current wait list that is listed for home-delivered meals. ADSD did receive funding through the American Rescue Plan Act to address the wait list and also to help build capacity. In receiving that funding, we also realized the critical importance of having the sustainable and consistent funding to continue to address rising costs, to address increased demands as well. Likewise, ADSD funds food security services, which include the traditional brick and mortar food pantries, mobile food pantries, and farmers market options. There is limited funding in this area as well, and in this area, the demand continues to increase. ADSD does continue to reevaluate what funding is available and the methodology to provide the support to the community partners in order to meet the increased demands and needs in the community.
Okay, thank you. Kirsten Kulama again for the record. So I'm gonna just walk through some of our transportation services that Nevada Medicaid offers. I will say Nevada Medicaid does cover emergency transportation, which is ambulances and air ambulances if someone needs to be, transported out of state. But the focus of our presentation today will be on our non-emergency transportation services. And so Nevada Medicaid is required federally to offer non-emergency medical transportation, and it would be for individuals eligible for Nevada Medicaid, but also if it's being transported to their Medicaid services that are medically necessary. So transportation, although it is covered through Nevada Medicaid, sometimes it can be a little confusing because we only transport to the Medicaid service. So unfortunately, Medicaid cannot cover transport to a food bank, but we are grateful for our partners at, the rural regional centers, or I'm sorry, not the rural regional centers, but the regional transportation commissions that offer, paratransit and the bus passes that would be available. And then Ms. Knighton will also go into some of the transportation that she covers through aging and disability. So I just kind of wanted to put that caveat out there because I know, as Ms. Rogers identified in their strategic plan, that transportation is a barrier. And, unfortunately, Medicaid is a little bit limited in the transportation that we can cover for services for individuals. So, but the type of transportation that Nevada Medicaid covers does include public transportation, so that would be bus passes and the curb-to-curb delivery service. So curb-to-curb can either be through paratransit, through the regional transportation commissions. We did also expand and allow transportation network companies, which you might be familiar as an Uber or a Lyft. And so we expanded that during the pandemic in order to ensure that individuals could get to COVID testing sites. And then when COVID vaccines were available, we wanted to make sure that we increased those options. And then we made those a permanent option after the pandemic. Another option that we do offer, so if someone has their own car and are still able to transport themselves, we do have gas mileage reimbursement for that Medicaid recipient. Sometimes people prefer to transport themselves, but certainly the ability to offset that cost through gas mileage reimbursement is an option that we do have. And then we also would offer stretcher vehicles if someone needs to be transported because of their medical condition. We do cover stretcher options. And then lastly, if someone has non-emergency transportation needs to go out of state for a scheduled appointment, we would cover commercial airline services. So all of the transportation does have to be to, again, a Medicaid covered service, and it does have to be prior authorized. An individual, so if a senior does need assistance getting to their medical appointment, that they might need a caregiver or an attendant, we do cover that transportation for the attendant so that they can help them get in and out of the vehicle and then transport them home. And then, of course, we would also cover an attendant for a minor child. So the transportation, so all of those transportation options that I just mentioned for Nevada Medicaid, that is done through a broker. And so our current broker is MTM, and they have been our broker for a couple of years. And so if anyone needs transportation, a Medicaid recipient that needs it, they would go through our broker, and I'll give you some more information about that in a minute. So they are prior authorized. for all of those services. And we do ask that recipients provide our broker, MTM, with at least 3 days advance notice for their scheduled appointments. And so that it really just gives the opportunity to find a transportation provider in their area to be able to accommodate their appointment times, the day and time. We do, for individuals that do have same day appointments. So, for example, someone that is being discharged at the hospital and the hospital might give them new medications or a refill, we can accommodate that trip to the pharmacy in order to fill those prescriptions. So that would be considered a same day appointment because it wasn't scheduled in advance to go to the pharmacy. So we can accommodate those same day or urgent transportation appointments. But in general, most transportation is scheduled in advance. I would say our most common transportation service is to adult day care or adult day health care, as well as dialysis, where individuals are going multiple times a week. And then, so how does someone get authorized for their transportation through Nevada Medicaid? So either the Medicaid recipient can call themselves, our customer service number that has the information listed here, or they can have a family member or a friend or even a social worker or someone that they're working with can call on their behalf. So it really it doesn't have to be the recipient to schedule it themselves. And actually there's two options. So they can either call our customer service, or we're trying to be a little tech savvy and created a web chat option. And so if someone does have that capability, they can also go through a chat and not necessarily have to call someone. So our customer service is open Monday through Saturday. So in order to try to accommodate any new appointments that might come through for that following Monday that someone might have that need, or if they're having medical appointments on Saturday. So that kind of concludes the overview for transportation for Nevada Medicaid, and then I'll turn it over to Ms. Knighton again for transportation through aging and disability services.
Thank you, Kirsten. Again, for the record, LaDon Knighton. The services, transportation services that are funded through ADSD are offered to individuals, older adults, 60 and over, persons with disabilities, and caregivers that's assisting individuals in need. Individuals do not or are not primarily on Medicaid. They are eligible just being older adult, an individual with disability. Transportation services are provided in a variety of ways, including vouchers, direct transport. They can be scheduled, they can be same day, depends on the availability and capacity of the partner. We do try to ensure that transportation services are offered statewide. So we do look at that in the funding methodology when organizations do apply for funding to provide transportation services. We do recognize that transportation is a critical need, and in fact, pre-pandemic, it was one of the number one listed need, especially for older adults, next to housing. Right now, the number one need has shifted or expressed need from the community to access and awareness of the services that are available. So ADSD is working towards ensuring that our partners, not only for transportation and nutrition, but the array of services that are provided through ADSD, there is consistent outreach. And with that, we are working on rebranding to ensure that individuals are aware of the services and how to access them. Individuals do not have to apply for transportation services, as they do not have to for nutrition. The main gateway to all services, which include nutrition and transportation, is Nevada 211. Nevada 211 can be accessed by calling, on the website, and by text. It is updated in real time, and it is available 24/7. And with that, we will be happy to take any questions you may have.
Thank you. Mr. Marchant, you have a question?
For Mr. Colum, on the slide, you said the funding was recommended for increase by a study, and you said the study was done by a contractor. Who was the contractor, and did they use anything just other than just inflation measures?
Kirsten Kulam for the record. Thank you for the question. So for the home delivered meals study, I believe you're referencing, so that contractor,
Yes.
we did a request for proposal and it was awarded to Myers and Stoffers. So they're a vendor that we work with on a couple of different projects. And so, yeah, so they reviewed, it did include inflation, but also it took into account provider costs as well as wages for their employees. It's kind of a complicated methodology, but we do have the report available on our website that I could provide Ms. Cooper as follow-up if you'd like to go through and see that report. And then it also will include a recording of the presentation when they walked through the report. Specifically, I will say that the rate study included multiple Medicaid services, so not just our home delivered meals program. It was one of several services offered through our physically disabled and frail elderly waiver, and so that was a piece of it.
So if I understand you correctly, the contractor used multiple indicators of inflation, but they're all inflation related.
They used multiple indicators to determine. Oh, sorry.
Yeah, but, well, when you say wages and increase in wages, that can be considered an inflation measure.
Sounds good. I'm on the policy side, so yeah, you could be 100% correct. I will probably defer to the report, and if you have specific questions, I can work with my the people smarter than I in the rates unit to share more information on what that methodology looks like.
The reason for my question is one of the functions of this committee is to provide recommendations to the legislature, and if we are to recommend a budget initiative, which you say is in the next line, we probably ought to know what what we're recommending. Mm-hmm. So if you have further information to clarify, that would be nice to have.
Kirsten Cohen for the record. Absolutely, yeah, I can send Ms. Cooper, Madam President, whatever information that they would like.
Okay, I have a second question for Ms. Knighton. What is a minoritized older adult? Is that somebody who wasn't and you made them that way? The usage of the past tense just confuses me to death.
Thank you for that question, LaDon Knighton for the record, and I apologize for that confusion. That is a current term used for individuals of minority groups, minoritized populations.
As a former professor who was concerned with usage, somebody needs to take that past tense off there. Yes. And make it so that we can understand what that means. I looked at that and I thought, somebody's playing with me.
Received.
Can you fix that, please? Thank you.
Yes, thank you.
I'm done.
Thank you. Mr. Troth?
Either one of you can field this on slide 4. The reference twice here, the American Rescue Plan Act funding has been used and is being used to make some of these actions happen. Doesn't that plan run out here pretty soon? And what's a thought process of replacing that kind of funding?
I can start. This is Kirsten Coulomb for the record with Nevada Medicaid. So yes, you are absolutely correct. The funding, Nevada Medicaid stopped utilizing the home and community-based section of the American Rescue Plan Act March 31st of this year, 2024. And so, we are essentially absorbing that in our budget now. We felt it was important to keep those home delivered meal services available to individuals on the for elderly waiver, but in terms of permanently adding it, that would be the budget initiative that we would require, and then a budget initiative to increase the rate over what it is currently.
So the legislature is going to have to come up with some money to replace that federal funding, right? If we're going to continue to run a program.
Kirsten Coulomb for the record, for Nevada Medicaid, correct.
Okay. Thank you. I have one other question on slide 5 under the ADS. Can you give us some idea of who some of the community partners are again? Who are some of these organizations that are providing some of these services or doing these services with the government money, right?
Yes, thank you for that question, LaDon Knighton. For the record, I most certainly will, and we'll be happy to follow up with a complete list. Some of the providers for food security and nutrition services include Catholic Charities of Southern Nevada, Helping Hands of Nevada, Lutheran Social Services, the Community Food Pantry, Nevada Rural RSVP, Meals on Wheels, Dignity Health. We have many providers that we can give a list for.
Yeah, if you folks could do that, because, you know, we've heard those a couple times, and it'd be nice to know who those providers are, because they're receiving some kind of tax money or government funds to execute these programs. And I think that'd help us as we go through this to kind of have a feel of who's doing all the work. That'd be great. Thank you.
Thank you.
Are there any other questions? Seeing none, thank you, Ms. Coulomb and Ms. Knighton, for your presentation. And the follow-up that you're going to provide, if you could send it to Ashley, that would be great. And then she can distribute it out. Thank you. Agenda item 6, overview of the Supplemental Nutrition Assistance Program. We are going to have a presentation from Ms. Kelly Cantrell of the Division of Welfare and Supportive Services. Ms. Cantrell, please begin when you are ready.
Good morning. For the record, I'm Kelly Cantrell, Deputy Administrator with the Division of Welfare and Supportive Services, and we've been asked today to do a brief overview of the SNAP program. So on the agenda, you can see that we're going to cover the overview, the basic factors of eligibility for the program, and ways that we are currently working on to reduce food insecurity in our division. So here we have a brief history of SNAP. And you can see that the first food stamp program started in 1939. And participants at that time were required to purchase food stamps, or the coupons that used to be back when I was a child. And you would purchase $1 in an orange stamp, and then you would be returned 50 cents in a blue stamp. And the blue stamp was only allowed to be used for items that were considered to be in surplus at that time. And so the Blue Stamps program, that particular program ended in 1943. And then 18 years later, the pilot food stamp program began. And once again, the participants were required to purchase the orange stamps, and they received that 50-cent blue stamp once they purchased an orange stamp. But the concept of using that blue stamp only to purchase surplus items, it went away. So that was not a requirement any longer. In 1964, President Johnson requested the program be made permanent, and in 1974, it became a nationwide program. The 2008 Farm Bill that was enacted increased the commitment to food assistance, to the food assistance program by more than $10 million over the next 10 years. And it also changed the name of the program from the Food Stamp Program to the Supplemental Nutrition Assistance Program, SNAP, in an effort to reduce the stigma that came with SNAP. They also, right around that time, just a couple years prior to that, started the EBT card program, and they went from the coupons that we all used to know and love to the card that could be swiped like a debit card. So what is the purpose of SNAP? So it provides a means to increase food purchasing power. It works to raise the nutritional level among individuals that qualify for the program, and it's a first line of defense against hunger for millions of families. One of the benefits of SNAP that is oftentimes overlooked or not really readily talked about is that SNAP also stimulates economic growth by putting money into the community. It stimulates farmers, truckers, grocery stores, and other things such as that. Along with the name change, in the SNAP program, they also implemented the SNAP Education Program. And the SNAP Education Program is a free nutrition and physical activity education program that empowers SNAP recipients to make healthy choices as far as physical activity and food purchases. They even have taught kids to grow gardens. They teach you how to use a whole chicken instead of buying, boneless, skinless chicken, stuff like that, to help the food dollar stretch. So how are people eligible? What are factors of eligibility that we look at when we're determining eligibility for the program? So residency, you have to be a resident of the state of Nevada. At identity, we have to verify your identity. Age, certain age groups are allowed certain specialized budgeting depending on age, like for example, seniors, folks with medical, seniors with medical expenses could be allowed special budgeting for that. Household composition, so who lives in the household, how are they related to you, and are they required to be part of your food stamp household? Relationship, citizenship, Social Security enumeration, and income are the things that we look at when we're determining eligibility for the food stamp program. So this slide here shows the 2024 poverty levels, or I like to say the income limits for applying for the food stamp program or the SNAP program. So if you look here under the 200%, an individual person could earn up to $2,430 before we start looking at deductions to see how much food stamp benefits they're eligible for. And then you can see down the line how that amount goes up for the family size. So the SNAP allotments are listed on this screen here, and you can see that a household of one is currently at $291. In 2020, just 4 years ago, right before the pandemic, the maximum allotment for a household of one was $204. And then in 2021, it increased to $250, which I believe was the highest increase I've seen in my career, and I've been doing welfare since 1999. In 1999, it was a 22% increase. It was just one of the biggest. And then today, it's now $291, and that's a 43% increase from 2020. Does it cover inflation? Does it make up for the price that food has gone up? Probably not, but there has been a decent increase over the last 4 years. So SNAP, if you're a 1 or 2 person household, comes with a minimum allotment, and that minimum allotment today is $23. This could be saved for up to 9 months so that one larger purchase can be made during the year if individuals feel that that $23 isn't enough to really be beneficial in 1 month's time. Currently, over 14,000 seniors are receiving that $23 or less in SNAP benefits. Okay. So let's talk a little bit about food insecurity. So SNAP is a federally funded program to assist income-eligible households purchase food. The U.S. Department of Agriculture defines food insecurity as a lack of consistent access to enough food for an active, healthy life. Studies show that 1 in 8 individuals in Nevada face food insecurity. There are approximately 501,000 individuals currently receiving SNAP benefits in the state of Nevada, and roughly 267,000 households. Okay. There's over 77,000 seniors age 60 and older that are receiving SNAP benefits. So what can we do to reduce food insecurity? So currently, our agency is working on a waiver so that we can start accepting telephonic applications, meaning someone who maybe can't get to us, we can pick up the phone, they can pick up the phone, call the agency, and we can complete a food stamp application with them over the phone. There are ways to do this that require storing the signature and the rights and responsibilities and everything. We don't have that ability at this time. So applying for this waiver will allow us to take those signatures while we work on all the necessary IT things to be able to store the information that we need to store. We are also at this time exploring the restaurant meal program. And the restaurant meal program allows elderly, disabled, and unhoused individuals to use their food stamps at participating restaurants. So for someone who doesn't have a home or a place to cook, or maybe someone who cannot cook food, they would be able to take their EBT card and go to a restaurant that takes the EBT card as payment and purchase hot meals at a restaurant. And I know it's not the most popular program sometimes when you talk to people, but one of the things that we've done is we are reaching into the community to see what kind of restaurants would be interested in this program. And to our surprise, we did get restaurants interested that aren't your just McDonald's or your fast food restaurants. We did get restaurants that provide vegetables and meat, like for example, Teriyaki Madness, right? It's a fairly well-balanced meal when you compare it to maybe like a hamburger or something. So we've had good interest in that, and we'll be exploring that further in the upcoming session. So how do you apply for benefits? So we always like to say you can click in, call in, or come in. And so you can apply online through Access Nevada at dwss.nv.gov, which is our online portal. You can contact our customer service unit. That we have a northern number, a southern number, and a statewide toll-free number that anyone could use to contact customer service. You can visit any one of our 22 welfare offices throughout the state of Nevada. We have them in many of the rural areas. But what I'd like to talk about is the over 200 plus outreach sites that the division is currently in. We are in senior centers, schools, health facilities, criminal justice facilities, libraries, and that's just a scratch of the surface. So 200 plus sites, we have individuals either sitting in person or virtually that if someone walks into, let's say, the health department, I've got an individual sitting over here at the health department that if someone wants to pursue any benefit that the welfare division offers, that person can help them apply, and they can walk away with an EBT card in many instances if that person's able to issue them. And so we meet people where they are. That people aren't necessarily required to come into the buildings because sometimes people don't want to go to the welfare office, right? But if we catch them at the library or they happen to see us in a place that they're going anyway, sometimes that stigma isn't really there for them, and they can talk to us. We've had one customer say, "Oh, I like coming here so much better. I don't like dealing with welfare." And our person is a welfare worker, right? And so she had to say, "Well, I work for the division, but I'm happy we could be here where you are." We also have 13 what we call trusted partner, but they're community partner sites that can actually take a SNAP application on our behalf and conduct the interview and collect all the verification. So when someone goes to, let's say, Food Bank of Northern Nevada, they can do the SNAP interview, help the customer complete the application, collect things such as income that we might need to verify the case or to process the case. And when that application comes over to our division, all we have to do is process it. We just process it and go on, and we don't even have to reach out to that customer again. And we just send them an EBT card through the mail, and they can go about using their benefits. And we're in food banks, family resource centers, but right now there's 13 of those community partner sites. And I think we went through this really much quicker than I had anticipated. So I think at this point, if there are any questions, I can go ahead and take any questions that you might have at this time.
Thank you for the presentation. Fred Silberkraus, Senate District 5. Could you explain or clarify the calculations or the meanings behind the gross monthly income, 130% of poverty, versus the maximum growth categorical eligibility, which is 200% of poverty?
Kelly Cantrell, for the record, I would love to. So in order for us to start looking at your household and then before we look at any deductions or anything, we see what is your income. If it's over that 200%, we stop there and you're not eligible for the program. But if you're under that 200%, then we start looking at things like your utilities, your rent. Do you have medical expenses? Are there any other deductions that we can take off of that gross income to get you under that 130% to then qualify for a benefit? So that 200% gets you in the door and gets us to work in a budget for you. And then your deductions let us know how much you're actually eligible for. Does that make sense? So in order to be determined, or in order for us to look at your eligibility and to do a budget to see if you get benefits, you have to be under that 200%. And if you're under the 200%, then we're able to start working a budget for you. And we not only look at what you earn, but we look at allowable expenses. And there's a list of allowable expenses. And once we do that whole budget, and it's a complex calculation, but once we do that whole budget, then we can determine if you're then at that 130%, how much you would be eligible for.
Mr. Troth?
Thank you for the briefing. It's pretty informative, and I appreciate the ability that you're really trying to make numbers of people and places for people to apply. I applaud that. I think that's important. That's one of the things that we find as we go through these. So many people do not know that, A, these things are available, and then where to go to them. So that's good. I have two quick questions. So you're telling us that about 500,000 Nevadans are using SNAP?
Kelly Cantrell for the record, that is correct.
I'm dumbfounded. Two, on your slide 10 with the restaurant meal program, what needs to take place to allow SNAP to be used in that context or use?
So we need funding for our side of that. But the other thing that needs to happen is that when a restaurant is interested, the restaurant themselves has to go to the Food and Nutrition Services, USDA, and they have to do their part in getting set up to be an authorized retailer, for lack of a better word. So they have to make that connection with FNS themselves. On our side, we would need to have coding in our system that says, hey, this person meets this criteria, so this particular card can be used at this location. So it's kind of a two-way street, and we just hope to meet in the middle to be able to make it happen. But the restaurants that want to participate have to do their side of it to work with the USDA to be able to become one of those retailers.
Okay, so some clarification. The current SNAP allocation or approval would not be eligible for this. That's a whole separate entity then? Is that
Kelly Cantrell for the record. So at this time, the state of Nevada does not offer that restaurant meal program at all, and SNAP can only be used at participating grocery stores for approved items.
Okay.
That part's not going to change, but the specialized households, the elderly, the disabled, and the homeless individuals, if we get this program up and running, those same benefits could be used in a restaurant. So they are the same benefits. It's the same allotment. It's not an additional allotment.
Okay, so the same money could be done. Okay, that's what I was trying to get to. So the allocations, wherever that SNAP money comes from now, if this program was approved, and that's a legislature, a state of Nevada legislature action that says, okay, we approve, now you vendors that want to participate, restaurants, you apply and are kind of vetted, and then they are authorized with, like you said, the electronic capabilities and all that to do that. Okay, so that was my bottom line question. This would not require more money. It's just another use of that money. Is that correct, or?
Kelly Cantrell for the record. So it wouldn't be more food stamp benefit money. The money would come into play because we need system changes and we need to be able to identify individuals, right? So it's stuff that's running in the background. But the actual benefit going out to the customers and the amount we bring in from the federal government for those benefits would not increase because of the program. It's just utilizing them instead of at a grocery store. Maybe this particular individual wants to utilize them at a restaurant.
Okay, thank you very much. Good.
Mr. Marchand?
You have confessed to being in the business for a long time. and so I'm going to be picky. You said the word homeless, and the current usage is unhoused, and I don't know where that came from because it does not improve the specificity of language. Homeless seemed to be just fine. Where did this unhoused thing come from?
So like you said, I've been around a long time. It's been homeless for me, but as we've learned, verbiage changes, right? What was once food stamps is now SNAP, and so what was once homeless now is more commonly called unhoused. Where that actually came from, honestly, I have no idea, but I try to keep up and use the vernacular that's...
We do see that verbiage changes, but if it changes, we'd like it to become more specific rather than less. Unhoused is less specific. But that's just me. Thanks a lot.
Mr. Silvercross?
Thank you. Again, Fred Silvercross, District 5. On slide 10, you talk about you're going to be requesting a waiver. Can you tell me the status of that?
Kelly Cantrell, for the record, I can. So we only have 2 food stamp specialists in the state of Nevada, and let me explain what that is. So all the programs that we stand up and all the things that we do in the food stamp program right now are done by 2 individuals. I have recently added a brand new individual to that, and I have tasked her with requesting the waiver. It's at its infancy right now. We haven't even written it or submitted it yet, but we're going to be working on that as one of the first items that she does. So we have many programs in food stamps, and I can tell you right now it doesn't necessarily apply to this committee unless some of individuals are raising grandchildren, which we know happens. One of the things that's taking a lot of our time right now of our SNAP individuals is the summer EBT program. It's huge. We have a quick turnaround time on that. So my newest person that joined that team is the one that's going to be writing that waiver and getting it submitted.
Am I correct in believing then until that waiver is written and approved, the only way to interact with SNAP would be in person at a location?
Kelly Cantrell, for the record, yes, that is correct. For the initial application.
Yes.
For the initial application, yes. Now you can drop it off in a drop box. You could hand it in to a person and not stay. And we can do the interview over the phone, but we would need that hard application and signature in the office to be able to do that. This would allow us to take the entire application, signature and all, over the phone, so no one would ever have to drop off an application or see anyone face to face. But for now, we have to get the application somehow. It can be mailed in. They could drop it, put it in the mail, to our PO box and mail it to us, and then we can call and do the interview over the phone. But we have to have that hard signature as of today until we get that waiver.
Pardon me, you might have already mentioned it, and I apologize for asking again. Where would you recommend a person could go to get that hard copy or that initial hard contact?
Kelly Cantrell, for the record. So online, our application is available online, and it's accessnevada.dwss.nv.gov. That's probably one of the easiest ways. But you can call our call center at either the Northern, Southern, or toll-free number, and our workers mail applications, email. They can email an application. They can put one in the mail and send it to a person. They can pick it up at any one of our physical locations that are all throughout the state, including rural areas. If they happen to get their hands on an application, they could also fax it into us if they had the capability to do that. And any of the community partner sites that I was talking about,
yes,
or any of the outreach sites could also get that application to the individual.
Great. Thank you very much.
Thank you. Ms. Batts, you have a question?
Thank you for your presentation. Okay, I just want to clarify, you said that it's 500,000 of people using SNAP in Las Vegas, and is North Las Vegas included in that figure? And what is the population of Las Vegas and North Las Vegas using SNAP?
Kelly Cantrell, for the record. So the 501,000+ individuals that are using SNAP is statewide. And for this presentation, I didn't break it down per county. We do that sometimes, or we break it down by city. I didn't for this, but that's for the statewide. As you can imagine, the greatest part of the population is in Washoe and Clark County, though.
Thank you very much.
Thank you. Ms. Peggy Levitt?
My questions have already been answered. Thank you.
Any other questions?
I will just make a comment. I've been around for a long time too. But I have to say that I also applaud your outreach so that there are many ways that people can access this program. And this is one of the few programs that in my work in social services that I didn't hear that many complaints about. So I think you're doing a good job. And I like this telephone access that you're working on. So.
Kelly Cantrell, for the record, if I might just say, we have 80-plus sites on our waiting list that we can't service because I don't have the staff to do it. So we are asking for additional staff also upcoming. So if I know you were interested in ways or things that might be helpful, that could be one of them. So I just want to get that in there. Thank you.
Any other questions? I have a question. Fran Alvarez, the card that you say people have now, each month your department loads onto that card their amount for that month. Does that card have the individual who is receiving the benefits, does it like have their picture on it or anything to identify who can spend that? And I'm just asking because at a restaurant, I'm just curious.
Kelly Cantrell, for the record. So there are no pictures on the card. What they do have is a PIN number. So when you use your debit card, you know, we put the PIN number in. The cards that we have right now currently have that PIN number associated with them. It's an elephant in the room. We know, I don't know if you've heard, but the Secret Service was out here and worked with Metropolitan Police Department, North Las Vegas and Henderson to do some education on SNAP fraud. And one of the things that they discovered while they were here, and I want to say they hit like 1,100 retailers, they found like 18 cloning and skimming devices where it picks up that. So we know that this is problematic, and as a nation, we're working on it together. They do have cards available now that are chipped, like the credit cards are chipped, the chip tap thing. And so that is something we plan to explore in the next couple of years. But we are working closely with our investigations and recovery department to get the word out to individuals on things they can do so that their cards aren't used or stolen. There's actually an app that you can pause your benefits when you're not using them. So let's say I'm an EBT recipient and I want to go to the grocery store. So I would go to the store, unpause the card or unsuspend it, if you will, make my transaction and then go right back in the app and pause it again so that other people couldn't use it before I got the chance to use it. And so it's a huge education thing that we're trying to do right now. But right now there are no pictures on the card. It's just that magnetic strip and the PIN number.
One of the reasons I'm asking this, and you were talking about people cloning the cards, there are people who sell them. Or when they used to have the stamps, you know, they didn't use them all, so they would sell them. Do you have anything, you know, that you can tell that the recipient is doing this, or is it just when the fraud investigators come in?
Kelly Cantrell, for the record. So we have our investigations and recovery unit, and I'm going to tell you, and this isn't very widely known, but I will tell you that that unit, right now they're furiously working on a lot of the cloning and skimming that have come in. But historically and traditionally, one of the things they do is they look on social media platforms. They stay on social media platforms, and they target words like cloning or skimming or 2 for $1, and they actually have found people doing that exact thing through social media. So that's one of the ways they can tell. I know if too many cards are issued to one address, it's an alert that pops up and notifies us. But just if I just, let's say I gave my card to a coworker and said, you know, here, you can go use it, very hard to detect the little one-on-ones like that. It's when there's bigger issues that we start getting wind of it. And if you give your PIN number to another person along with your card, it's challenging. It's hard for us.
Thank you. Are there any more questions? Frank, you have a question?
Yes. Yes, actually, it's more than, it's about a statement. You know, all these PIN numbers and all these, you know, different ways of doing things, I think it's just easier to have a photograph of the person that is a recipient of the card, and you wouldn't have to go through that. And I think you would save more money in investigating that way as well. That's just my opinion. Thank you.
Thank you, Ms. Cantrell, for your presentation. Agenda item number 7, an overview of the provision by Nevada 211 of information and referrals for organizations and programs that provide health, human, and social services. We are very, very lucky to have Ms. Kalina give us this presentation related to the Nevada 211. Begin when you're ready.
Thank you, President Alvarez, and good morning, forum members. For the record, I am Ashley Kalina, Constituent Services Analyst with the Research Division of the Legislative Council Bureau. At the forum president's request, this presentation is merely to provide a very brief overview of the most recent quarterly service report for Nevada 211 and an informational handout page of how individuals can access a variety of health and human services and resources for seniors. This was provided to us, these documents were provided to us by the Aging and Disability Services Division of the Department of Health and Human Services. Due to copyright considerations, the documents are not uploaded to the forum's meeting page, but they are included in each of your folders under Agenda Item 7. The copies can also be accessed from the Legislative Council Bureau's research library. The quarterly service report, which can be found under the tab Agenda Item 7-A-1, offers data collected from Nevada 211 calls made from January through March of 2024, and this illustrates the benefits of Nevada 211 services, the demographics of individuals who contacted Nevada 211 during that time frame, the top 5 needs of those requesting resources, the 5 zip codes where individuals are in need of most assistance, and a comprehensive breakdown of client resources requested. The Nevada 211 informational handout page, which is found under the tab Agenda Item 7-A-2, demonstrates there's 3 ways an individual can contact a service coordinator for information and referral services through Nevada 211. An example might be someone who needs assistance with housekeeping, some meal preparation, or transportation to the grocery store. They can either dial 211 on their phone, go online to nevada211.org, or text their zip code to 898-211. And this was already provided by Ms. LaDawn Knighton in her presentation earlier today. If you do need or would like more detailed information about Nevada 211, you might like to review the presentation that was given to the forum. It's called Nevada's No Wrong Door System, and it was provided during the forum meeting on July 14th, 2022, during the last legislative interim. If you need help navigating to find the links to review that meeting, let me know, and I'm happy to walk you through that, or I can send you the link to the meeting. If you have any questions specifically related to Nevada 211, please let me know that as well, or any of the staff members. And we're happy to facilitate a discussion with ADSD. They specifically have an individual who's a Nevada 211 coordinator, and they are either happy to continue a further discussion, or if you would like a more in-depth presentation, let President Alvarez know, or myself, or any of the staff members, and we're happy to set that up for you. Thank you, President Alvarez. This concludes my presentation, and I'm happy to take any questions at this time.
Thank you, Ms. Kalina. Are there questions? Seeing none, we will move on to agenda item 8. Oh, wait, I'm sorry. Mr. Marchant, you have a question?
I'd just like to congratulate our presenter for brevity.
Thank you. Moving on to agenda item 8 is our reports from the facilitators, both north and south. Neither of them are in attendance today. So we will move on to agenda item 9, which is public comment. We will start our public comment for those in the physical locations and then move on to public comment from anyone who has called in. Public comment will be limited to 2 minutes per speaker. We will time each speaker providing public comment to ensure everyone has a fair opportunity to speak. Please remember to clearly state and spell your name for the record. Is there anyone in Carson City who would like to provide public comment at this time?
Not at this time, thank you. Mary Fesenmeyer from District 17.
You have a comment, Mary? Go ahead.
I'm sorry, I indicated no comment. Very informative. I don't actually know if food insecurity is as critical an issue as transportation is in my district. Thank you.
Thank you. Seeing no one else in Carson City, we will move on. Is there anyone in Las Vegas who would like to provide public comment at this time? Seeing no one, BPS, please add the first caller with public comment to the meeting.
Thank you. Once more, the public lines are open. However, there are no callers to offer public comment at this time.
Thank you. That concludes our meeting for today. Our next meeting will be on Wednesday, June 26th, and our final meeting is going to be August 7. I do want to reiterate that August 7 will be probably a fairly long meeting, and I hope you will adjust your calendars so that everyone can be here. That's when we do our work session for whatever BDR we are choosing. I also wanted to say, Mary, especially for you, we do have presenters on transportation at the June meeting. So hopefully your questions and many of ours will get answered then. Ms. Batts?
Yes, Madam President, will our meetings still be in this building or the new building? Our next two meetings?
We don't have the details on that yet. Many entities in this building have started the move, but we don't know for sure. But you will get an email to that and an address for the new building. Any other questions? Meeting is adjourned. And thank you all for being here.
Thank you.